And good afternoon, February 20th, 2024. I'm Dr. Deuk. Our patient is here for treatment of her back pain. She is a professional bodybuilder, and she takes great care of her body, but she's been struggling with horrible pain in her back, and it turns out she has pain from more than one place. We've identified a lot of sources of pain. One of them is the disc at L4-5. And so we're going to go in there and fix that. She also has facet joint pain at L4-5 and L5-S1 shot. And she has sacroiliac joint pain as well as piriformis pain shot. All right. That's it right there?
Yes, sir.
All right. Let's go ahead, shot, and let's get an AP. So the first thing we're treating, she has thoracic facets, lumbar facets, right sacroiliac, right piriformis, and disc at 4-5. We're going to treat everything but the piriformis today. Her spine looks relatively good, so hopefully this fixes the problem and she moves on with her life. All right, very good. We're almost ready for her. And if you're not ready, we can go on to her facets. Is she awake?
Can you open your eyes for me? Hello? Can you open your eyes?
If you need a few minutes, we can move on to the...
Open your eyes now. Hello? We're going to ask you some questions, okay? Can we ask you some questions?
Now, how long has she had her back pain for?
8 years.
Nikki, you're on fire.
At least 6 months ago.
Lower back pain, 8 years. It's gotten a lot worse in the last 6 months. So she found us, and she's here. She wants to be fixed. Are you awake?
Hello, how are you doing? Can you open your eyes for me? Yeah.
Lay still. Try not to get up. You're doing great. We're here in the operating room. Everything is
I'm
fine.
going to ask you some questions. All right, open your eyes for me. Can you open your eyes? Good. Okay, perfect.
Are you comfortable?
Are you having any pain right now? Are you having any pain right now? No? No pain. Okay.
All right. Think I need a minute or two, or you think she's ready? All right. Well, here we go.
Give us a number, okay? How you doing?
How bad is the pain on a scale of 1 to 10?
Give us a number. 0 to 10. What'd you say?
There's a small
10?
tear. 10.
10.
10 over 10. Is that where you get your back pain? Is that where you get your back pain? Yeah. All right, 10 out of 10, 4-5, concordant. You can put her to sleep. When you wake up, we'll be done, and that pain will be gone. So she has, as I said before, pain coming from different places. We're going to fix her disc first. She's got a small tear. You can see the dye leaking out. It's tried to heal itself. It hasn't been successful. Do we have num-num for the skin? Oh. All right. Let me make an incision. The entire endoscopic surgery will be done with a small incision, 7 millimeters. Now, we just confirmed that that disc 4-5 is definitely causing back pain. 10 out of 10, she said. Henry, let's show the audience, how is it that a disc injury can cause so much back pain? Shot? Okay, welcome back. You can see from our video how these herniated discs cause so much pain. It's all due to inflammation inside the disc. That was discovered at Deuk Spine Institute by me and my partner, Arias Deuk-Majan. Look at right here, guys and gals. That is the inflammation. You guys see the pink?
Yes, we do.
That should be white, not pink. The fact that it's pink, it's inflammatory. So that is exactly why we're here. That little spot. And you see how this procedure takes you right to it. It's the only surgery in the world that takes the doctor directly to the source of back pain. And that's why this patient is here. That's why the last patient's here. He was from Portugal. So we have patient from South Carolina, Portugal, Virginia, and now all the way from Daytona Beach, where they actually canceled the Daytona 500 this weekend.
I was going to go.
Because of rain.
Yeah, I was going to go. I was
Yeah.
kind of upset, but it's all good.
Yeah, well, the reason is those guys that do the Daytona 500, the drivers, they don't know how to use a brake.
True.
Yeah. Anyway, this is the source of her pain, and we're in here cleaning it up. Now, a lot of scar tissue, lots and lots of scar tissue. That's what this white stuff is at the base here. So we're going to fix the disc pain. We're going to fix the facet pain, but she does have piriformis. We won't be fixing that today. We're going to probably do that in the future for her. And that, I feel that is going to bother her. I've told her that. So we just have to let her get it done when she's ready to get it done. It turns out that 20% of all patients with chronic back pain have 7 or more sources. And each source has its own pain nerve and needs to be addressed individually. So in her case, she has, in her thoracic, we believe she has 2 facets. In her lumbar, 2 facets plus the disc, plus the SI, plus the piriformis. Huh? Yeah, she's on that 7. You get a lot of people with 7 or more. And like I said, 20% of the patients that we treat have 7 or more causes to their back pain. So that means, folks, if you just go have a disc surgery done, it's not going to take care of the problem, right? Because you're fixing one disc. You're fixing one source of pain. At Deuk Spine, we're big advocates for make the right diagnosis and then render the proper treatment to the actual source of pain. All right, there it is. We're done with this disc. I'm almost finished right here. We got the inflammatory tissue. Most of it, here's a little more right there, the pink stuff. And we're just about finished. A lot of scar tissue from chronic inflammation. It's been going on for a long time. Years and years and years. Any questions from the audience, Henry?
Yes, we have a question from Frank on YouTube.
Hi, Frank.
And they ask, do you take out-of-state workers' comp?
We do take out-of-state workers' comp. The only one that we don't deal with is New York. The only way to get New York work comp treated here, you have to get your adjuster to agree to pay for the treatment. New York used to be okay. They were a pain in the butt. You know, we'd have to call them 100 times. We'd spend hours on the phone after we did the surgery trying to get them to pay the bill, even after we had a contract with them individually, and they would just drag at their feet, hoping that we would go away. You know, but these insurance companies, they love to just drag their feet to pay. So we were doing work comp. It take 2 years to get paid for the surgery, but at least we got paid, and we were able to do New York work comp for years. But then New York changed this policy, and they want all the doctors and hospitals to use their online portal. And what it is basically a wasteland. They just send you there, and it's impossible to navigate through it to get the patient's, surgery approved. And they know that. That's why they send us there. It's like saying, go cross the desert, the Arabian desert, without any water, without a camel, without a horse. And when you get to the other side, yeah, then I'll give you a bag of rubies. You'd be a fool to take that mission on. You're never going to make it. So New York work comp is the only out of state we don't take unless you get a good adjuster who's honest, has some integrity, and they'll actually pay for your surgery. But we won't use the portal. We refuse to use the portal. It's a death trap. All right, we're done with the first disc, and we're going to move on to the facets. And then the last thing we'll do is the SI joint, sacroiliac joint. Now, for years, people had back pain. Doctors didn't know why. And then we discovered it was the sacroiliac joint. That's the joint between your tailbone and your, hip bones. And lots of people have pain coming from their SI joint. It comes from an injury to the SI joint. And just like any other joint injury, whether it's your knee, your hip, your shoulder. By the way, this is the blood loss. 2 drops of blood, the whole surgery. 2 drops. Isn't that beautiful? All right, we're going to take this out, and that's it for the discs. We're going to move on to our facets. So for years, doctors didn't understand where's the pain coming from. Where's the pain coming from? It turns out it was the sacroiliac joint. I'll show it to you in a minute. And then we started doing injections, steroid injections, and lo and behold, you get good results with the steroid injections, but they don't last, So we started to, we're doing right 4551? Shot? We started to, oh, look at that, Jordan. Look at that. Spot on. Perfect. Perfect. That would make a experienced pain management doctor like Dr. Patel blush. So it turns out that people with the SI joint pain, they would end up suffering needlessly, but we learned to do shots, and that made them feel better for a little while. But then eventually, guess what happened? The shots wear off, and then somebody came up with this idea of SI joint RFA. Right? Great idea, it just doesn't work. Is our pad grounded well? I need you to check. Make sure it's stuck on the skin perfectly and evenly. There should be no bubbles or anything. Huh? It's on perfect? I may. Give me a second. I would place a new one. All right, we're just going to take a minute and wait for our probe to be. So for our probe to work, which is our plasma probe, it has to have a circuit connecting to the body. And I've been using these for so long. If it doesn't work perfect for me, there's something wrong. I'm always going to look over and see what's going on and try to fix it. The most common thing is do you want me to put a staple here? The most common thing is that the pad is not on right. And that's a problem. You don't want that. Take your time, guys. Take your time. Do it right. Thank you. Take your time. No rush. We're good. Yeah, but I definitely want a new pad. So, yeah.
Do you see more SI joint pain in women than men?
Do we see more SI joint pain in women than men? It's a great question. I have no idea. I don't even pay attention. But it's a very good question.
I always saw more of it in women, and I always attributed it to pregnancy, loosening of their ligaments.
Don't know.
Anatomy too.
Don't know. They do have different pelvic anatomy. But the question comes from Dr. Davis, orthopedic surgeon, and he's asking, you know, do you notice if women or men get this problem more often? And I don't really know. Dr. Patel may know, but it may be out there in the medical literature, may not. But long story short, talking about the treatment of the SI joint, it was, first of all, not diagnosed, nobody knew, and then it went to being diagnosed and injected with steroids, which helped temporarily. Pain always comes back. And then it went on to RFA, which doesn't work. And then now everyone's advocating fusions for like the last 15 years, SI joint fusion. And the payment to the doctors is really good with the SI joint fusion. You make a lot of money. But it's a very dangerous surgery and very painful, long recovery. And in my opinion, you can really hurt the patient. The complications are severe. Jordan, let's get a quick x-ray up here. Let me know when you guys are ready. They're ready? Yep. All right, let's get a quick x-ray up here and just see where this is. All right, yeah. Perfect. More common in women? All right. All right, let's go back down and we're going to finish the lumbar facets.
It's due to pregnancy.
I think it's okay. Let's see. At least I think it's connected properly. Shot? All right. A little north. Any questions? Shot? All right, that's good. Yeah, that's perfect. That's right where we want to be.
Yes, we have another question from Frank, once more on YouTube, asking, can you review MRIs from 2 years ago, or does it need to be more recent? I've had 12 years in pain with all doctors saying they can't help.
2 years is okay, Frank, but I would strongly recommend you get something more recent. New probe, new handle, all of it. Probably just a new handle first.
Can I have a pencil, please?
All right. So to answer your question, 2 years old is kind of old. I would recommend something within a year and a half maximum. But the reality is that 2 years would be a good start. We can do your free MRI review with that. You just have to go to our website, mri.deukspine.com, fill out the form, upload your report, send us your MRI CD images, or give us your portal access credentials and link, and then we'll do an MRI review with you. I'll tell you what's wrong, okay? And then we'll tell you how to fix it. Let's try that. Be ready with another one of these just in case this doesn't work. Tell me when you're connected. It's the same. Let me just have that before you do that. Let me just have that. Yeah, give us a second before you turn it off and on. Well, it's working. Go ahead and shave it. Let's use that one.
This one right here.
Yeah, the new one. Go ahead and shave it. All right, so any other questions?
No current questions, but we do have a comment from Jim on YouTube.
Yes, Jim.
They said, I hope you can help me, sir, doctor, waiting for the MRI review.
Wonderful, wonderful, Jim. I look forward to it. There's no doubt that I can help you. If you're having pain, that's what we fix. Shot? All right, so at this point, I have changed out a few things and want to make sure, yeah. She has really nice anatomy. All right. There's one down. Shot. Now, see that, Jordan? Just remember, who's your daddy? Okay? You tell Dr. Patel. You tell Dr. Patel who's the man. Shot? My partner, Dr. Patel, who's not my marital partner, just my partner, he is in India with his family. He hasn't been back to India in 12 years. And he lost his father this year. And I know he went back to visit family, but he and I do a lot of the same type of treatments. I just do it better. Shot? All right, so that's the perfect spot where we need to be. We're done right now with, her anatomy is just amazing. Honestly, I hate to say it. I wish all my patients were as nice. She's thin, she's muscular, she's perfect. Okay, we're done with the facets. I'm going to move on to the SI joint. So, you want to do SI? Oh, yeah, we're going to do the thoracic. Sorry. We'll do that first. All right, so let's go ahead and do the thoracic facets. Shot. And there's T12 right there. Beautiful. You want to make sure when you're doing these, you're on the bone, on the back of the bone. Shot. And we are. Shot. All right. You guys see the pedicle there?
Yes, we do.
That's what you want to see. Show us the pedicle. And the transverse process comes right off the pedicle. Yep. So it's perfect. Let's get some num-num. I'm sorry? I don't know what you're doing, but I like the other one that I was using. That's fine. Sure, yeah. No problem. All right, we put some numbing medicine to make it more comfortable for our patient. And then we're going to make our incision. And the incision for this surgery is 4 millimeters. When you see it, you'll be amazed at how small it is. Shot. That's perfect. We're right over the facet TP, transverse process. Let's get another shot. Great. Any questions, Henry, from our audience?
No current questions, but we do have a comment from Sue on Facebook.
Sue, of course.
They
Hi,
said,
Sue.
good to catch up with you for a few moments. Great stuff. 5 years since my DLDR and still good.
Still what?
Still good.
Oh, wow. Sue, thanks for sharing. 5 years. I get people all the time saying to me, Dr. Deuk, show us a patient who's, had the surgery a long time ago. And I'm like, the problem is I can't ask my patients to come back just to do a video. It's not right. So, unfortunately, I don't have any long-term testimonials. They're all short-term because our patients are so happy and they're just gone. We don't see them anymore. Huh? Yeah, we're getting a lot of muscle tightness, but shot. All right. Any other questions, Henry?
We just got this is a comment from Samir on YouTube
Shot.
saying, hello, Doc. Missed the live surgeries last week while you were off. Hopefully your shoulder is doing good. I'm coming to see you and to get my L5-S1 fixed.
Samir, so wonderful to hear from you. Thanks. And Thank you for your concern. It's genuine and it's appreciated. My shoulder is back to being normal. For those of you who didn't know, I have a hobby of gardening, and I specifically was planting some plants, and I lifted some heavy pots, and they really took a toll on my shoulder. So thank you for your concern. All right, I feel the transverse process right here. Now, she's got a lot of muscle. And the problem with muscle, normally muscle is a good thing, but the problem with muscle for this particular procedure is that as soon as you activate this plasma probe, the muscle contracts. And it pushes the probe away from where it's supposed to be. So I've got to really hold it in place. That's a little higher than I want to be, right at the top. She's definitely not making it easy for me. Shot. That's why it's taking me a little bit longer than normal. She's, again, a bodybuilder. She's got a lot of muscle. And it's literally pushing me away from her. And so my probe is being pushed backwards, which is, it's a safe area, but it's not what I want. All right, that's it. We got that one. I got one more to go. This poor woman has been suffering with this pain for a long time. A lot of bodybuilders have pain, you know, back pain. Whew, her fascia's tough. Shot. There we go. I felt it there for a second. There we should be it there. Shot. Oh yeah, that's the facet. Let's go just down. Shot. Shot. Just got to get the right spot. I'm not happy yet. It's too important to get it just right. Shot. Is that it? Right there? Oh yeah. That feels pretty good. I think we should have it there. Right there feels like the perfect spot. Let's just see where that is. Shot? Yeah, that's the perfect spot. So you can tell it's in the valley between the facet and the transverse process. There's a little valley there. All right, that's the thoracic and the lumbar facets done. Now we have the SI joint. Whew. No. Oh, yeah. Okay, you're right. So we're done. So end the broadcast, and then let's switch over to the SI joint.